Hello everyone, my name is Dr. Ankur Khandelwal and welcome back to my channel. Today I'll be showing you one classical case of tennis elbow, which is also known as lateral epicondylitis. I have a patient with me and he has given me the permission to make the video for medical education. Ki naam apunar?
Himanto.
So his name is Himanto Kalita. Boy ki man apunar?
37.
His age is 37 years. Aru ki kaam kore?
Driving ko.
So he is a truck driver by profession. Ki okubida apunar?
Beef.
Kiman dima pura?
Duma.
So he has come with the chief complaints of pain on the lateral side of the elbow joint, which has been since 2 months. Upora torot big hoy? So the pain is typically confined in the area of lateral aspect of elbow joint, and he complains of pain in this aspect of the extensor muscles. Correct? So pain in the lateral aspect of the elbow joint and along the extensor muscles of the forearm. It gives you a clinical clue of tennis elbow, which is also known as lateral epicondylitis. Why lateral epicondylitis or tennis elbow occurs? It occurs mainly because of the overuse of the extensor muscles of the forearm. It occurs because of the overuse of the extensor muscles of the forearm. Apart from this, some injury may also take place either because of degenerative injuries or because of some trauma. So some professionals are particularly get this type of lateral epicondylitis, like tennis players. That is why it is known as tennis elbow, right? Because of this repeated wrist extension and overuse of the extensor muscles of the forearm. Similarly, painters or cooks, truck drivers, so they tend to have overuse of this extensor muscles of the forearm, especially extensor carpi radialis brevis, and they come with chief complaints of pain in the lateral aspect of the elbow joint. That is how we clinically diagnose it as lateral epicondylitis. Further on, we have certain clinical tests to confirm whether it is a tennis elbow or not. We do not require further imaging, it's a clinical diagnosis. So I will show you how to go for clinical examination for tennis elbow. First examination is simply you can palpate at the lateral aspect of the elbow joint. So when I have pressed it on the lateral aspect of the elbow joint, the patient is complaining of pain. This is one simple test when you can palpate at the lateral aspect of the elbow joint and see for the pain response of the patient. Now he is complaining of pain. Ase weak? Ase. Number two is the Cosen's test. For Cosen's test, it is very simple. Just pronate the forearm, a bit of flexion. First pronate the forearm, bit of flexion, and then make the wrist a bit radially and ask the patient to extend the wrist against your resistance. Ask the patient to extend the wrist against the resistance. Utha, pura utha, जोर दिले किबा होय test. He is complaining of pain. What I have done is that against the pronated and flexed forearm, I have asked the patient to forcefully extend the wrist against resistance. See it again. Utha. So see, he is complaining of pain right at the lateral aspect of the elbow joint. This is Cosen's test positive. So what are the treatment modalities? In the acute phase, usually we ask the patient to avoid overuse of the forearm extensor muscles, right? So we'll ask the patient to take rest for some days and give some anti-inflammatories. Usually most of the patients, they respond very well to restriction of certain type of movements, and they respond to anti-inflammatories. Second modality is that when patient do not respond to this anti-inflammatories and rest, in the rehabilitative phase we ask the patient to do some stretching exercises. So stretching exercises, they help in recovering from tennis elbow. Further on, if the patient still doesn't get relieved of the symptoms, we can go for some TENS therapy. If not, then if the patient is still suffering, it's been some time of physiotherapy not responding, then we can go for corticosteroid injection, glucocorticoid injections at the affected site, which usually provides a short-term relief. Over a period of time, long-term duration, no benefit has been seen with corticosteroids or glucocorticoids, but to relieve of the severe pain, this is indicated. Further on, in the chronic phases, we can go for FFP therapies, and there are certain other therapies like shockwave therapy. All those therapies are there. But usually in our setting, what we do, we start with some anti-inflammatory and some rest for few days. If the pain doesn't come down, we go for glucocorticoids injections, and the patients usually responded to very well. So this is in a nutshell all about why tennis elbow occurs, where it happens, what are the symptoms, how to clinically diagnose it, and go for treatment part of it. Thank you so much. We'll come back again with some more informative videos.